puffy eyes from a young age? I thought it was because I had late nights, but looking at pictures from when I was a child, I saw that the puffy eyes were with me then also. At 18, I find it horrible because I'm such a young person with such an old, tired looking face. I've tried using makeup, eye creams, and cold teaspoons to reduce the swelling, but nothing helps me. I'm not sure if it's hereditary or allergies, but I know I suffer from nasal congestion when I try to sleep. How can I get rid of the puffiness?
Thank you for your question. I really understand your frustration that at the age of 18 that you have puffiness under your eyes and it's making you look older. I can share with you that in my practice, I've had patients as young as 14 years old who have had bags under their eyes that they had since they were little. And unfortunately, this is a genetic trait, especially when you've eliminated all the other possible causes. You mentioned late nights and not sleeping enough, allergies, sinus problems, and other things. If there is puffiness under your eyes, regardless of the time of day or environment or the amount of sleep, then the most probable issue is something called lower eyelid fat prolapse. Now, what does that mean? Well, that basically means that around your eye there are these fat pockets, and it's referred to as extraconal fat. And it means that these fat pockets act almost like a cushion around the eye. Now, in some people, at different times of their life, the fat pockets push forward. And when they push forward, it creates this bulge and the look of under-eye bags. I can tell you that many of my patients, before they come to see me, have gone into drugstores and have tried different types of creams and lotions to try to get rid of the under-eye bags, and of course they don't work. So usually, if you were to come to me looking at your age, your skin type, and assuming that the conclusion is that you have lower eyelid fat prolapse, if it's bothering you enough, then I think it's worthwhile for you to consider a lower eyelid blepharoplasty. Now, this is a big decision, so I would suggest that you really do your research, meet some doctors, and before you move forward. But what I typically do is something called a transconjunctival blepharoplasty. That means going from the inside of the eyelid, getting to the fat pockets, and sculpting the fat pockets so that you don't see the bulging of the fat pockets anymore. Once that's done, that is essentially a permanent solution. Permanent meaning long-term for 10, 20 years, especially for someone who's very young. Facial aging does continue, but you have a long time ahead of you before that becomes a concern. So to answer your question about the puffiness, essentially you have what appears to be lower eyelid fat prolapse, and that the recommended procedure I would do is a transconjunctival blepharoplasty. So hopefully you'll be able to take this information and go further and meet with doctors to consider your options, and I wish you the best of luck. Thank you for your question.